Meno Warriors, it's Kate and welcome back to my channel where I give you tips every Monday on something menopause related. Today I'm actually going to be talking about lateral hip pain. So pain that you get on the outside of your hip, also known as the greater trochanteric pain syndrome. The greater trochanter is on the top of the thigh bone and it's at the widest part of your hip. It is really common in women in menopause, and as well as joint pain in general. This video will actually help you understand why you might be getting joint pain. At the end of it, I've got a few tips to help you reduce those joint pains. You might actually find that one of them is quite surprising. So just listen in. This is going to be quite short and sweet because not an awful lot to talk about the greater trochanter. But if you're getting hip pain, if you get joint pain, please leave a comment below. I'd be really interested to hear. Also, make sure if you find these helpful, subscribe to the channel, or if you're watching this on social media, please share it with a friend that might need some support, or just give it a thumbs up. Essentially, what happens is as we go through the perimenopause and the menopause, our collagen, as well as our muscles and our bones, all suffer in actual fact. As our estrogen levels and our progesterone levels fall, it affects the creation of collagen. Now, just to explain, because a lot of people don't understand the difference between ligaments and tendons and how they interact. So ligaments attach bone to bone, tendons attach muscle to bone. So tendons are very, very, very strong bundles of collagen. So if you imagine a collagen strand is a piece of string, well, when you've got lots of pieces of string and they're bundled up together, like happens in our body as the collagen strands, and then there's loads of these little collagen bundles all bundled up really tightly together, they become super, super strong. And it's those tendons that attach the muscle to the bone. So whenever we're doing like weight training, if you're doing a bicep curl or something, you're also exercising the tendons at both ends of your biceps. Those biceps, there are two muscles, not just one. And tendons also are renowned for they don't have a blood flow like the muscles do, which is why if you tear a tendon, it can take ages for the flipping thing to recover. Same as ligaments, they just do not have the blood flow. And when the blood flow is slower, they just don't recover as fast because the blood flow essentially delivers nutrients to the muscles and all of our tissues. But where the blood flow is less, of course, it takes longer to recover from those sorts of things. As you recover, if you have got a sore tendon, or if you're recovering from an injury with a tendon, actually massaging the muscle that the tendon is attached to will also help benefit the tendon. So while you might not be able to put direct pressure onto the tendon, by actually massaging the muscle wherever that tendon is, you're naturally going to enhance the amount of blood flow that goes to that tendon. So always remember, there are certain things that you can do despite having a tendinopathy or a tendon injury. So work on the muscle. That in and of itself will help benefit the tendon because you're increasing the blood flow to the tendon as well. So just quickly, perimenopause can last up to 10 years. Normally starts in your late 30s, but I've heard of a girl in her age 13 who started with perimenopause. Obviously, if you have surgery, hysterectomy, etc., that can bring on sudden surgical menopause. And menopause is when you haven't had a period for more than 12 months, although I have read quite a few reports also suggesting it should be for a period of 2 years to actually classify yourself as postmenopausal. The menopause is actually 1 day, and it meant that day of menopause, it signifies the 12 months since your last period. After that, you're postmenopausal. So the majority of our older life is spent in the postmenopausal phase. So to just sort of, you've got like an image now of what the collagen bundles look like and how they attach to the muscles. So I think that's a really important concept, that what, if you can see it happening in your inside of your body, in your mind's eye, it helps to make that recovery better, and it just gives you a better understanding of what's actually going on. So tears and micro injuries to the tendons, like I say, do take longer, but it doesn't mean to say that you have to give up movement for it to heal. In fact, I am a huge proponent for telling everybody to stay mobile. It might be that you have to adapt and modify what you're doing, but you should still stay mobile. When our muscles and our tendons and our bones need us to move. When we're using our muscles, so when we're doing like a strength training program or any kind of exercise, in actual fact, we are creating little micro tears, micro trauma inside of those connective tissues, muscles, tendons, ligaments, etc. What happens when we are doing those exercises? Those micro traumas are absolutely fine. And then our rest days, which is why they're so important to take, is when those micro traumas then heal. And because of the micro trauma, the healing process makes the tendon and the muscle grow back stronger. So that's why, you can start off with literally zero muscles or very weak muscles. And with practice and with a proper exercise regimen, you can create a body of steel if you wanted to. We all start off with not great muscle definition. It's only through exercise and repeated exercise that we start to sculpt our muscles, as it were. And by doing regular activity, you're strengthening the muscle fibers, you're strengthening the tendons, you're also strengthening your bones. And that is something that is so important to recognize through the menopause. As we go through the menopause, we have a much greater risk for brittle bone disease and bone softening. That's down to we have more cells that gobble up bone cells and fewer cells that are actually laying down new cells. So by actively stimulating the production, keep the blood going through, make sure you're doing plenty of strength training that's creating those micro traumas, you are necessarily helping your bones keep stronger, as well as preventing muscle atrophy and keeping your muscles and your tendons strong. It's vitally, vitally important. I cannot emphasize this enough, that when you are perimenopausal and going through into postmenopause, strength training should be an absolute no-brainer for you. It doesn't need to be strength training that's crazy hard. It just needs to be strength training that is pegged to your fitness and ability level, and one that is also allows sufficient rest. I follow a block periodization process, which is essentially, in fact, I'm coming up to the end of my 3rd week next week. I do 5 days of strategic exercises 5 days a week for 3 weeks. I have the weekends off, and then the 4th week is for active recovery and full rest. So that active recovery might be roll and releasing, it might be a sort of more in-depth stretching, it might just be going out for a couple of mountainous walks, that sort of thing. But it's absolutely essential that when we go through the menopause and the perimenopause and menopause, we need to be allowing ourselves possibly more recovery time. If you're getting, the odd niggle's fine, you can work through it, but don't let that niggle become a pain. Become very good at thinking, am I actually feeling fatigued today? Is that pain in my shoulder or my hip or wherever it might be? Is that something that I can manage or manage well, or is it something that's actually causing me distress? If that's the case, just modify what you're doing. Instead of, talking about the sort of the greater trochanter, the hip pain, lateral hip pain today, because our hips are weight bearing, so much goes through our hips. Most of us have not got core strength or sufficient core strength. And so, a lot of us are misaligned. We need to fix our posture as well. And strength training is going to help you do that. It'll help you rebalance the body, and it will help to maintain a healthy posture so that your weight is evenly distributed on your hips. And that if you've got good core strength, you're necessarily going to be holding yourself in a way that's not going to have you sort of like plumping down on your hips. Sometimes you see people walking and they're so heavy on the hips, and you just think, oh God, I wonder what their joints must be like. Movement also really helps to stimulate the cartilage, the growth of the cartilage. Most of the joints in our bodies are synovial joints, which means that they're a socket. They're a synovial socket, capsule is the right way to call it. And by moving ourselves regularly, by doing intentional movement, you're stimulating the production of the synovial fluid. Well, the synovial fluid is actually nourishing the inside of the joint. It's helping to keep it running smoothly. It helps to feed the cartilage. So I just cannot stress it enough. Strength training has to be done. If you are struggling with lower leg pain, do an upper body workout. If you're struggling with shoulder pain, do a lower body workout. If you are struggling with shoulder and hip pain, do a core-based workout. When you follow a proper program, you will find that, like, you know, I have a day which is upper body strength training, and the day after that might be the right kind of cardio, so you're not spiking your cortisol for too long. The day after that is probably, well, the program I'm following at the moment, it's triceps and back, and the day after that is then legs day, and then the day after that is biceps and chest and shoulders. So there is, you know, we're working one sort of group of one body part group every day, but on rotation, so nothing gets strained. And that is the way to do it. When you are recovering from injury, with whether it's the greater trochanter or whether it, you know, any kind of tendinopathy, any kind of soreness in your muscles, there is evidence, and a lot of evidence, pointing to do fewer reps, heavy weights, so long as they're not causing you pain, and much slower. When you do movements more slowly, you can focus on form, which is so important. Most injuries are caused because you're not keeping proper form. You may be a little bit fatigued, and you just like, oh, like, you know, if you're doing an over a shoulder press or something, and you're not holding in your core, and you know, your chest isn't over your hips properly, and somehow you let it go because it's so heavy, and then you find you feel something go in your back or your obliques or somewhere like that. That is because you've not listened to your body. I cannot tell you the amount of times during the workout I will start out with one set of weights, and you know, within the 15 reps or 12 reps or 10 reps, I will change those weights to a lighter set. So I'll do 2 or 3 lifts with what I can manage at that weight, and then I'll go lighter again. Sometimes I go heavier, but quite often I'll start the heaviest that I can manage, and then I'll go lighter. So it really is about, it's not about lifting heavy and being like Arnold Schwarzenegger. It's about listening to your body, doing fewer reps, slower reps, and sometimes just do it with body weight. If you can't lift a weight, but you've still got movement, you know, if a lot of women have frozen shoulder after menopause. It seems to come on really, really fast. Adhesive capsulitis. You know, if you're recovering from that, you know, make sure that if you might not be able to lift a weight, but you might be able to just lift up your hand, but apply resistance to it. So I could just do that really easily, or I can really apply resistance to it. It's really hard. And you might not be able to go, you know, your movement might just be up to here, but with practice, that's going to improve. You can lie on the floor. I know this is about hips, but so many of you struggle with shoulder problems. Lie on the floor and just do like angels on the floor. Just really, really slowly lift your arms off and just move them around. And with practice, you will improve your range of motion. And that is really important so that you can get back to a normal set of activities, really, to be quite honest. So that explains the sort of mechanics of what you need to do to help you get beyond tendinopathy, and also to help prevent injury. So ideally, fewer reps, heavier weights. Excuse me, I've been painting this morning, and I've got this really annoying piece of dust in the back of my throat. Excuse me. Oh, that's better. And make sure to follow a program that is specific to your needs. That's all I would say on that one. So yes, we've explained that falling estrogen and progesterone affect how we create collagen. Vitamin C is absolutely essential for collagen synthesis. So you might be having joint pain. Excuse my dog in the background if you can hear him coughing. You might be having joint pain, and I recommend vitamin E supplement, and also cutting out caffeine. For me, that made a massive difference. I know I get a lot of vitamin C in my diet because I eat a lot of fruit and vegetables. If you don't eat a lot of fruit and vegetables, I would consider a vitamin C supplement, or be more mindful about what you're eating. Try and eat lots of berries, lots of green leafy vegetables. They're going to help you with your cruciferous vegetables, are brilliant at helping reduce menopausal symptoms on the whole. But make sure that you are getting sufficient vitamin C. Our body stores it for about 2 weeks and then it's gone. So, you know, having a regular supply of vitamin C, ideally from your food, is going to be the best way forward. Vitamin C is a very strong, powerful antioxidant. It also helps us to decrease inflammation. So if you're getting, inflammatory markers in your tendons, if you've got that tendinopathy, if you're getting joint pain, it might be, or if you're recovering from surgery, make sure that you're getting sufficient vitamin C. It's also a cofactor for opioids. So it helps us manage pain more effectively. When I had my double bunionectomy in May last year, I was obviously on a bit of pain relief afterwards. I had it under a local anaesthetic. And for the first 3 days, your feet are pretty painful because you've obviously got to walk around. You can't not walk around either, especially when you've had both feet done at the same time. And so I had pain relief then, but I was really mindful, particularly when I was out of hospital, because the hospital food was just pants. If I'd known it was going to be that bad, I'd have packed all my own lunches and dinners and taken them by myself. So make sure, if you're going in for surgery for anything, make sure that you've got a vitamin C supplement with you, particularly if you're going to have any prolonged period of time in hospital, so that at least you can get some vitamins in your body, or ideally pack some food, or get a family member to bring some fresh food in for you, so you're getting plenty of vitamin C into your diet, because it will help to prevent the inflammation. It helps you manage pain more effectively, and it's a brilliant antioxidant for us. Just be mindful that if you are consuming a lot of sugar, that is going to affect how your vitamin C is absorbed. And actually, vitamin C and glucose have a very similar chemistry, and the body will always absorb glucose first over vitamin C. If you're insulin resistant, so if you're diabetic, or if you're sort of pre-diabetes as well, you'll find that you are not absorbing vitamin C as effectively as you might do. And so you might be having joint pain and not really understanding what's causing it. Yeah, you might be taking pain relief. You might be taking all the expensive collagen supplements. Yeah, if they work for you, great, keep on taking them. I'm a bit on the fence. I do take a collagen supplement for my bone health, really, or joint health more than anything. I think it probably benefits my skin too. Mine is a bovine supplement. I'm on the fence between, I keep trying to work out, is the marine collagen better than bovine collagen? Should you just make your own bone broth from beef bones and do it that way? It's probably a much cheaper version if you want to do it. I quite like the convenience of just having the powder. So yeah, I do take a collagen supplement, but I think also because I do so much exercise, proper exercise, not over exercise, I have but proper exercise, that I manage really well with my joint pain. When I cut out caffeine and had my vitamin E supplements, I used to get out of bed in the morning and walk like the Tin Man. It was like I'd seized up. But then once I did my workout, everything got moving again. And I seem to have moved beyond that period now. I can now drink caffeine. I'm not taking a vitamin E supplement at the moment, and my joints seem absolutely fine. So I think, that there are phases that you can go through, which is why I always recommend not to take supplements forever. Take them and then come off them again and see how you're managing. And I'm a big believer that if you can get your supplements through diet, do it that way. I eat loads of nuts every day. I eat peanuts, they're my treat, and I eat Brazil nuts, walnuts, macadamia nuts. I can never remember the other nuts. There's those little flat brown jobs. I don't know, I feed them to my mice as well, the mice that are still running around my roof. Hazelnuts, I just buy mixed nuts, and I eat a good 2 handfuls of those every single day. By the way, I think you only need about 3 Brazil nuts to get enough selenium, which is also vital for your particularly postmenopausal. So get into, if you can eat nuts, make sure you're eating plenty of healthy nuts. I eat a lot of healthy fats. Avocado is something I eat pretty much every single day. So I eat with them, when I look at a handful of nuts, I don't look at the nut, I don't look there's a Brazil nut and 2 walnuts and 3 hazelnuts in there and almonds. I look at them, oh yes, well, that's going to be good for my brain, that's good for my joints. That's my vitamin E. There's my healthy. I just selenium. A range of healthy nuts is going to do you so much good, and you don't need too many of them. They're obviously very high in fat. I think fats get a bad rap. If it's a healthy fat, just eat the bloody stuff. It keeps you fuller for long. And nuts are full of fiber as well. They're also a plant. So, you know, when we're talking about eat your 5 vegetables and fruit, or 8 fruits and vegetables a day, those count under that as well. So a lot of people don't realize that. So do herbs. If you put a lot of herbs in your food, that also goes towards your daily vegetable count. So just in summary, collagen bundles are what help to form our tendons. We can, because us going through the menopause, falling estrogen and falling progesterone are going to affect the amount of collagen that you're creating. So you need to be doing your own work to make sure you're stimulating as much collagen production as you can naturally. And you do that through clever strength training and taking appropriate rest days. On top of that, yes, you can try adding a collagen supplement and see how you feel on that. How much vitamin C do you think you're getting in your diet? If you're not getting sufficient vitamin C, maybe to start taking vitamin C supplement and see how that affects your joint pain. If you're thinking, oh, perhaps I'll get a collagen supplement, I would try vitamin C first and see how you get on with that. Collagen is, I'm a great believer of it being on the inside out. And I think if you're eating plenty of healthy fats, lots of vitamins, antioxidants in your diet, and you're moving regularly, intentional movement, I'm sure people will disagree with me, but I tend to think you can probably create sufficient collagen yourself. I've never read something that actually says, yes, if you take collagen internally, it's definitely going to improve your joint health and your skin and your hair. That doesn't mean to say it won't. I've just never read anything definitive. However, you know, in our world where we're looking at sort of holistic remedies and complementary therapies, there are very few reports that say definitively that anything specific works, because there's not massive profits to be made from it. Be your own best tester. Maybe get a tub of collagen. If you want to get the tub of collagen that I use, send me a message and I'll send you some details through on it. If you want to get a vitamin C, I get mine off Amazon, but I do also make sure to that I'm getting it from my diet as well. I do keep a pack of vitamin C in my cupboard for whenever I've got a raging cold, or if I feel like I'm coming down with something, I will take an extra vitamin C tablet. Once that's done, I don't take any more extra vitamin C. So use supplements temporarily so that you can get a grasp of are they actually working, because you don't want to be paying for something that's not working effectively for you. And intentional movement. So I really hope you found that helpful. Make sure to give me a thumbs up. Please subscribe to the channel so you don't miss future episodes. And yeah, give me an idea on, you know, drop a comment below. Have you had joint pain? Have you found anything that's worked to help you alleviate that joint pain? And before you do anything and go and buy anything expensive, try vitamin C first, because that is probably going to help you because of the antioxidant, anti-inflammatory properties of it. And if you're not already strength training and you need help getting started, again, please message me. I won't make you do unless you're fairly fit already. I have access to thousands of workouts which are going to suit you as a menopausal woman. Zero impact. Strength training, slow and steady wins the race, which will help you. If you need to lose weight, it will help you reach a healthy weight. But most importantly, it's going to strengthen your muscles, it will strengthen your bones, it will strengthen your tendons, your ligaments, and you will feel fantastic. I promise you, you will feel, it just makes such a big difference to how you present every day. Just seems to give you like that, yeah, I can do it. So anyway, thank you for your time. Thank you for your company, and make it a great week. If you've got anything you want me to cover in a future episode, just drop me a message and I'll be glad to do that. Talk to you soon.